Welcome, everyone. I hope you have all managed to log on to this conference, wherever you might be across Australia. We're very excited to be bringing you Care to Communicate from the Centre for Cultural Diversity and Ageing, their 2021 conference. For those of you who are just logging in, we'll give you a few minutes grace with a bit of technology and adjustment. I think this is a new platform for some of us, but in the world of online conferencing, I think to the large extent, many of us are probably in a familiar space. But bear with us as we also navigate through a new platform on our end. I would, before really commencing with the proceedings, I'll introduce myself. My name is Tasneem Chopra. I am your MC for today and delighted to be here as a guest also for the Centre for Cultural Diversity and Ageing for this incredible conference and this opportunity. I would also like to preface today with an acknowledgement of country and acknowledge that the Centre for Cultural Diversity and Ageing acknowledge the traditional owners and custodians of country throughout Australia, paying our respects to Aboriginal and Torres Strait Islander peoples, their ancestors and elders, both past, present and emerging, and acknowledge their continuing connection to land, sea and community. We would like to extend that acknowledgement and respect to any Aboriginal and Torres Strait Islanders peoples listening to this presentation as workers or consumers. And we hope that our work contributes to fostering respect and recognition between cultures in Australia. This is really an exciting time to be having a conference when the issue of aged care in this country is really one of the most foremost topics of conversation that we continue to negotiate both in public media, even in our social media sections. And of course, in a professional realm, we know that so many of us are actually working right in the thick of an issue that is constantly evolving and for good reason. I'd like to also acknowledge the sponsors for today. This conference has been funded by the Department of Health under the program for the PCAC program. It's been led by the Centre for Cultural Diversity and Ageing and supported by Benetas. And for those of you who are attending, I know I believe it's in the hundreds, so that's quite a feat. And we have representatives in aged care, we have carers, we have peoples from educational institutions, several representatives from the departments, both statewide and federally in education, in aged care and in health, and so much more. So there's a lot of you out there. There's a lot of interest that's been generated in this topic. And kudos to the Centre for Cultural Diversity and Ageing for being in this sector now for 26 years. Their last conference was in 2015 or 2018, I believe, and that was on setting standards. This conference on Care to Communicate is really going to centre on the issue of communication, of language, and how the two of those intersect to create a sense and atmosphere of belonging and inclusivity. So it's a very pertinent topic. And I just want to provide a little bit of context for what to expect for today. But before I do that, you will note on your screens, I believe on the right side of the frame where you're actually seeing me, there's a chat section. And that chat section is there for you to say hi, how you're doing, what's going on. And I can see there's some comments there already with some people struggling to have access, could be a connection issue, waiting for others to join. But you are all out there. And I can see some of our guest speakers are also in the chat room waiting to present as well. So I can see Ruth is there. So hi, Ruth. That's there. But as our presenters also participate with various sessions throughout the day, there'll be an opportunity for you to ask targeted questions to them. And those questions can be asked, if you look below the screen, there'll be an area that says ask question. I believe it's a coloured box, and you can tick on that coloured box and actually formally ask your question, which will then be something that I can read and definitely contribute to the speaker as well, and necessarily curate if we have a lot of questions, or at least streamline them if we have a repetition of questions. So this is an opportunity for you to engage. It's interactive in the sense that if you have issues to be addressed, there's a platform to do it, and we will do our best to get to all the questions, which if we can't answer formally, we can certainly take on notice And I know that the team from the Centre for Cultural Diversity and Ageing are really keen to be able to support you in your inquiries, because they're also committed to this issue and centering the issue of communication so strongly in our sector. In terms of, again, how we got to this point and how we've reached this particular conference title, I wanted to sort of hark back to what is the power of language and how useful or necessary is that in the way that we interrogate workspaces when it comes to our older people. So there are a lot of current conversations ranging from budgetary issues that have been allocated towards aged care. There is, of course, the Royal Commission that was recently held and the findings that came out of it. There's the aged care quality standards, which in 2018 have only recently, I guess, embedded diversity and inclusion, but we've not really seen a lot for that. So we talk about the standards of diversity and inclusion in that formal sense. What does your organisation, what can it show for that? How much more could it improve? So I guess going beyond the rhetoric, interrogating substance and asking the necessary questions, sometimes pointing out the elephant in the room here, which is the silencing of culturally diverse narratives and why that is so important. That's what I'm hoping this conversation will raise and more. The Royal Commission received complaints from providers and consumers in 2019, where over hundreds of recommendations were made. And in amongst these recommendations was a very clear shortfall of a diverse and inclusive lens fed back into most of the recommendations. There were several issues raised, and they included issues ranging from access, eligibility, home care quality, interpreters, vulnerability and discrimination of older people, and all of this under an overarching lens of cultural diversity and how that was lacking. So I guess in terms of why you're here and why am I here, what are you actually hoping this conference might sort of achieve for you? I would like you to perhaps consider before you, really get into the meat of today, what it is that's your motivating force about being here. We know that we're all about ensuring diversity and inclusion are included in operational standards. But what does that mean? You will hopefully learn more about the innovative approaches to inclusive practice by leaders in the aged care sector, which will be addressed later on by the Centre for Cultural Diversity and Ageing, promoting issues like commitment to inclusive services, developing systems that support inclusive services, and capacity building for inclusive services. There's a lot there. You'll also get to ponder how you and your organisation can contribute to better services within your organisations. I'd like you to think about what the gaps are for caring of older people, what limited communication can mean in effect for voices not being heard. What has general silence in this space for so long meant for access issues and quality of service for aged people in our community? How do you advocate for in-language communication? For older people who are averse to technology, who are dealing with isolation, whose carers are dealing with isolation, who are losing agency as they age, who are being spoken about but not spoken to, who are being planned for but not consulted with. For all those intersectional burdens of aging whilst being culturally diverse, perhaps being hearing impaired, having a disability or suffering from dementia, there are so many layers and rafts of considerations to be made in this space. And I hope that you can think about it. And I guess before we start today, I want to end with a bit of a quote, and that was Arundhati Roy, who's a noted writer and philosopher. She famously quipped that there is no such thing as being voiceless. There's only the deliberately silenced or the ignored. And I would like to think this conference space is an opportunity to redress that and to make sure that voices are centered in a platform of respect, and we can all together in tandem at least aspire to move towards a service delivery point that is inclusive and equitable and meaningful. So I'm delighted to be presenting a showcase of subject matter today with experts in the field, subject matter experts who in many ways could be I guess, could be regarded as superstars of the aged care sector. And between them, they will canvas topics of cultural competence, co-design, leadership, reinventing strategies, and more diversity and inclusive models of practice that you probably haven't thought of before. So there's a lot to be gleaned there. And I want to begin now by introducing our first speaker for this session. We'll be commencing this program with both a presentation and a keynote, after which we'll invite a Q&A session from you all. So the delegates will be entertaining those questions, and again, you can feel free to ask those in the question portal that you can see below. In amongst that, please continue to chat amongst yourselves on the side column if you'd like to do that as well, and perhaps catch up virtually with each other in this space. I'd ask you to communicate in real time in the comments forum, and think about the topic specifically, knowing that we have about only 10 minutes of question time at the end of these two sessions and hundreds of you out there. So please give some thought to what you want to ask, but know that if it doesn't get answered today, it will be taken on notice.